Thank you, everybody, for joining us here today. I'm Beverly Jones with Foothills Forum, and of course, what we are passionate about doing is finding ways to support independent, in-depth reporting on issues that really matter in Rappahannock County, and we partner, of course, with Rappahannock News. We've got a great partnership. We've won some prizes, and we're very excited to continue with the support of the community and folks like you. Rappahannock News is here today in the person of Dennis Brack, and I think Patty's actually going to write a story about what we're doing, or are you covering this today?
Okay.
All right. Assignment made.
Vote yourself.
I think what I'll do is, we hadn't planned to do this, but since it's a decent, manageable sized group, do we mind just going around and everybody introducing themselves? I was going to introduce our co-sponsors, but I'll talk about their groups afterwards. But does that make sense, Stephen? And Jenks is behind you if you start, and then.
I'm Jenks Austin from Foothills Forum.
Great.
Stephen Brooks, Foothills Forum.
Ross O'Donoghue.
And if you represent a group, not everybody has a group, but if you represent a
No,
group today.
each group, so a member of Rapid Home, but we have a representative.
Okay.
I'm Bud Meyer, and I'm the chair of Foothills Forum. I'm delighted to see this turnout. Thanks for coming today.
I'm Shannon Grimsley, Superintendent of Rappahannock County Public Schools.
I'm Rob Marino with the Free Clinic.
I'm Dennis Brock from the Rappahannock News, and also very delighted for the turnout. Thank you.
I'm Jane Bowling Wilson with Northern Piedmont Community Foundation.
Todd Summers with Sperryville.
Lindsay.
Oh, me, Lindsay Sonnet with Foothills Forum and Rapid Home.
Nancy Button.
Louis Miller, Berryville.
Ellen Adams, Rapid Home member, and I work for Rappahannock Community Service Board.
I'm Hal Hunter, and I don't represent anybody.
You represent everybody. Loretta Brazil.
Mike Mahoney, spouse of a member of the board.
Patty Hardy, Rapid Home, and Rap News.
And please come in.
Thank you.
And then we have a back row if you guys want.
Bruce Jones. Will Cole.
And Chloe Persman.
Hi, Annie Williams. I'm the owner and practitioner of Mountainside Physical Therapy. We've been serving the community for 10 years now. Also, Mountainside Dance Center. And I have a nonprofit, which is Hazel River Healing Retreats.
Satisfied customer.
Nancy Stead, Sperryville.
And then Judy.
Judy Ridinger and the Sperryville Rescue Squad. Also work with Benevolent Fund and so forth.
And I'll introduce Randy in more detail since he's our keynote speaker. And Dennis.
Dennis Berry, Rapid Home.
So, and we have a couple of co-sponsors, but we'll let them say a couple of words in a bit. But let me just tell you what the program is today. It's really simple. We're focusing on the three-part health series, of course, which I know you all know, and we're very proud of it. And we're very proud to have Randy Ryland with us today. He's going to talk a little bit about how he went about researching how his process was, what he learned, and then we will basically open up the discussion for everybody here. The focus of the discussion is very much local. It's within the framework of the series, but it's also a great chance to expand the record or correct the record. If there are other issues that weren't raised in the within the series and should be on the table, well, we've got a reporter who just got the assignment from Rap News, and so we will be able to put it in the record of the proceedings. So with that, I will introduce you a little bit more to Randy Ryland, who we're, like I said, we're very pleased to have him doing some wonderful journalism for Foothills Forum and Rap News. But I'm also particularly excited to have him on the team because I have known Randy for a pretty long time, since he was in college. Randy is a distinguished journalism, and he has a skill set and expertise that really particularly works on some of the issues that we're dealing with today. He started in newspapers. He was a newspaper guy, and then he became senior editor of the Washingtonian magazine in Washington. From there, he went to Discovery Channel, where he became the senior VP of digital, and so he was one of the early pioneers looking at digital media. And after Discovery, he went to, became the digital guru and the editorial director for Remedy Media Health, which was a health news service. And so digital and health are his specialties. The most important thing, of course, for all of us here is that Randy and his wife have had a house in the county for over 10 years, and so issues like aging and beautiful Rappahannock are issues that you have some interest in. But he also has deep expertise in health and health technology issues. Randy, would you, and you don't have to stand up, I'm just sure. So please give us an overview.
Sure. Thanks to everyone for coming. I really appreciate your interest in the subject and your support of Rap News, certainly, and the many other activities that you're involved with here in the county. When we first started talking about this series, I guess last spring, we were talking about some other things, and I had, it just entered my mind when I was working on the broadband and cell phone series last year. From time to time, there were the issue of healthcare came up. And you know, I hadn't really thought much about that, but more people who were thinking forward with healthcare said, you know, it's really, broadband is a really important part of this. And it just made me think about all the different things that are happening in the county demographically, the things that are happening economically. The county is kind of changing its personality in some ways. What does that mean? Some people pointed out to me, well, you have more people who have more means than in the past, and therefore they might have better health care, and they don't have the kind of chronic health problems that perhaps existed in the past. But you know, I think the reality is, and I'm certainly approaching those ages, when you hit your 70s and 80s, you know, all bets are off. And I think, you know, there's a growing percentage of people in this community who are already in that age range or approaching that age range. So it's important to look at, well, what does that mean to this county? What does it mean to it in terms of how it's set up with its rescue squads, what healthcare facilities are available here or not? What are the trends in terms of, I didn't want to get into any political issues. You know, there's enough people covering that. But there are issues related to how rural hospitals are surviving or not. One of the more recent statistics I've seen was that 40% of rural hospitals in America are losing money. And 80 have closed since, I think it's 2010. And you know, and when I talked to the CEO at Culpeper, and this was in the story, he said that we've done our analysis and found that about 25% of the people who come into our ER are uninsured. And he said that may not sound like much, but you have any business where a quarter of the people are not paying anything for the service, and it's going to be challenging. And so that's kind of part of the reality of this issue. Now, as with anything, I thought the broadband and cell phone series was complicated, that's a complicated subject. This is way more complicated because there are so many aspects of it. And one that I really hadn't given enough thought to until I started working on it was the simple matter of travel and access to healthcare, which is, you know, at the top of the list. But I was aware of that, but I really wasn't aware of how significant an issue that is. And so, you know, when I do these series, I kind of just plunge into it and start asking people a lot of questions, and one interview leads to another, and some, you know, people will mention different people to talk to. I try to talk to as many as I can. I did feel that, well, first, just to back up a minute, rural healthcare, the sort of challenges that exist in Rappahannock County are really universal, and at least, well, not universal, they're in the U.S. All rural communities are wrestling with this. You can't get doctors to come out to rural areas. They can't, they can't feel like they can't pay off their med school debts if they're working in rural areas. You certainly can't get specialists out here. Mental health, as Rob knows, is a big challenge in rural areas. And you have the issue that's in some ways unique to Rappahannock, in that, as everyone here probably knows, the rescue squads are all volunteer, and this is the only county in the state of Virginia where everyone's volunteer, which is, you do an amazing job. It's really an amazing job, but you have that age situation. You have a lot of older people, except for you. But I mean, the reality is, there's, as with any volunteer organization, there are a lot of people who are involved, but there are a more limited number who are really involved, who are there all the time. And some of those people are at an age where that's really demanding to do that. And so I think that's something that's unique and distinctive about this, and kind of behind that whole conversation is the issue of eventually the county needing to get into some sort of hybrid situation where you have some paid and some volunteer, but there are all kinds of issues related to that. That's not, none of this is a slam dunk, and I can't tell you how many people told me there's no silver bullet. There's no silver bullet. They're not going to just resolve all these things and solve these things. One of the really promising things that I found was the range of volunteer services and activities and the commitment to volunteerism here, which is no surprise to anyone here. It really is uplifting to see that, but it's demanding, and it's, as with any volunteer operation, it takes a lot of work and a lot of dedication by as many people as you can get, but these sort of things are challenging. I know Darcy over at the senior center, I mean, she spends a big chunk of her afternoon just kind of working out a schedule for who's going to drive who to where. And it may not seem like much, but it's like you're juggling balls in the air all the time. And she does a great job, but is that the sort of thing, as the population gets, continues to age, how easy or difficult will that continue to be? So transportation becomes another big part of this whole discussion. I found that it's really was interesting to see what's happening with the hospitals in this area, the challenges that they have, and the sort of things that they talk about. When you ask them, well, what's the future? What are the options going forward? And one that I mentioned in the story was the use of telemedicine, that there's going to be more dependence on people connecting through machines. But as my colleague here, Dennis, mentioned to me, that's not a simple thing either. I mean, there are, as we know in this county, there are technical issues, there are financial issues, there are, and please correct me if I'm wrong here, but when it comes to reimbursement for those activities, it's not generally at the same level as you'd get with more traditional healthcare treatment. So and I don't know, it's probably wrong to call it experimental, but it's not as simple. There's not a process. And then one of the other things that people have talked about, and this relates again to the whole idea of a hybrid rescue service. There's more discussion of relying more on first nurse practitioners instead of doctors in rural areas. And even I've read in some communities they're looking at using paramedics who, because they're maybe not making the frequency of calls that they might in a more of an urban area, where they're actually out doing basic medical support. Now, I'm sure there's all kinds of insurance issues related to that, but I think that this is something where around the country, I looked around to try to find, well, where is someone nailing this problem? And I'll be honest, I'm sure it's out there somewhere, but I didn't find it. Where a community has said, okay, we figured out how to deal with this, because there are so many different aspects of it. It is very complicated. I mean, I don't want to just go on and on. There are just a couple things I wanted to mention that just to reiterate some of the points that were in the story, and just to get a sense of this, in terms of the number, and these are national figures, but in terms of the number of physicians per 10,000 people, it's 31 physicians per 10,000 people in urban areas, it's 13 in rural areas. And you know, here, it's 3, really, in this county. And with specialists, you know, it's much, much worse. It's 263 per 10,000 people, or per 100,000 people in an urban area, and 30 in a rural community. So, and those figures are only going to go down. I mean, no one's saying, oh yeah, someday all these more doctors are going to be moving to rural areas. That's just not going to happen. So it becomes an issue of you have an aging community, you don't have the facilities, and you don't have as many doctors. So what are the solutions? I think people are looking for technical ones. I think there's going to be more dependence on volunteer organizations, but maybe in a more structured way. Because right now, it's, you know, with the volunteer organizations, a lot of it is just the generosity of spirit and time of the people involved with those organizations, and their ability to stay on top of things. But I know, you know, and talk to Lindsay, in fact, you know, and other people who have go out to people's homes in this community. People aren't necessarily forthcoming about, you know, their personal issues or health issues that they might have. But the sort of thing that, one of the things that has made this community so attractive to everyone, that solitude out here can really spill over or evolve into something much more serious, which is social isolation. I think that's a real, everyone told me that's a real issue. I mean, it's a real issue in urban communities with older people. They tend to stay inside their homes because they're fearful of things, or they don't have a way to go out, or they don't feel like they have anything they can do. Here, when you have some of your neighbors like a mile over this way and a mile over this way, it's very, very easy to have that happen. So that's just generally what I wanted to talk about at this point, and I think wherever people want to take the discussion.
Okay, before I open it up to everybody, and I hope everybody will join in, I just want to give our co-sponsors, if they want to say something, an opportunity. Aging in Place, Sally wasn't able to be here. I know you're a last minute fill-in duty for Harold, who wasn't able to be here. Did you want to say anything in part of the representing the rescue community?
Well, like you said, I wasn't, I
Yeah,
didn't know I was
there.
going to be up front.
Yeah.
But certainly it's very, very important. Harold had a couple of them.
Yes.
But I can bring those in.
Okay, as we discussed. And then Dennis, do you want to introduce Rapid Home?
Yes, I do. The mission of Rapid Home is to enable seniors in this county, surrounding areas, to age in place, to stay in their own homes as long as possible, and to furnish the services and support and referrals for services that people can do that. We follow the village model. Many of you are going to be familiar with that. It started in Boston, Massachusetts. There are now villages all over the country, although we are not quite unique here, but almost unique in that almost all of the villages in the country are in urban areas. There are only 2 or 3 that are in rural areas. A friend of mine is on the board who's actually started up the village in Capitol Hill in Washington, D.C., and he said what they had going for them was their members were in a densely populated area. It was a homogeneous community in terms of socioeconomic status, and it was affluent. And when you go through that list, we have differences in Rappahannock, which pose challenges for us, but we're, I think, meeting those challenges, and we're still working at it. Rapid Home, or to my knowledge, does any village, we do not furnish hands-on healthcare services. So why am I talking to you at all? Because this is about healthcare. Well, what Randy was talking about is access to healthcare and we don't have much in the county, and it's outside of the county. It's in Warrenton, it's in Culpeper, Front Royal, perhaps Luray, Charlottesville, Washington DC, or the DC suburbs, Manassas. So then the issue becomes, how do you get from here to there? And transportation is an issue. We don't even have some of the transportation options that folks have in cities. Although I learned that just this past week that Uber is extending services into Rappahannock County. But just to go to Warrenton, I think is a $39, Eve?
Somewhere in there. It's really pretty prohibitive for an awful lot of people.
It's expensive. I mean,
$16 to get from Little Washington over to the Headmaster's Pub, something. So,
Yeah.
So we got to do better than the parents.
Yeah, so I mean, I welcome Uber in the county, but transportation to healthcare is a challenge. Rapid Home offers that to its members. Incidentally, we do charge membership, but we are a nonprofit organization and we have free memberships based upon financial need. We're not the only organization in the county that furnishes transport. HAL has been involved with the Road to Recovery for many years, which drives folks to appointments related to cancer treatment or cancer diagnoses. And there are other services in the area, but historically there's been a lot of stuff that was kind of available on paper, but when you drill down into it, getting someone to your house to actually transport somebody was a challenge, and we are at least part of the solution to that challenge. We have, I believe, 12 volunteer drivers, and it's working. And Lindsay she's our volunteer coordinator, and she's handling multiple requests for transportation every week. And just I came out of a career in healthcare. I was not a clinician, I was a lawyer for hospitals. But I can tell you the rural hospitals are really, really stressed. That's not going to get better anytime soon. There are many systemic problems, which is a matter of public policy this country is just not addressing. Physician distribution, well, the number of physicians overall per population is a problem for this country. We're not training enough physicians, but the ones we're training are coming out of their medical school and residency programs owing many times $200,000 or $300,000. And you know, they're making choices not to go into primary medicine, but to go into a specialty or to go to an urban area because they just have to make some money to pay off those loans. And that's not going to change anytime soon either. Okay, I digress. Emergency transports is another issue that is somewhat problematic. The one piece of it I want to talk about is the volunteer issue is a really important one for this county, but the issue I want to talk about is we have seniors who are calling the emergency services when there really isn't that much immediately wrong with them medically. And the services respond, they always respond to a 911 call. And when they get there, it's not their job to say to somebody, oh, we don't think this is medically necessary. They are going to transport the person who called them. And they have some, it's not an overwhelming number, but they have more transports than they should, where the patient goes to the hospital, there really isn't much wrong with them. There's nothing wrong with the patient, and 2 or 3 hours later, the patient can be seen that quickly, the patient's ready to go home. And this is a social problem more than a medical problem, and Rapid Home can, we hope, address that issue with some people in our community who are facing social isolation, because we are trying to build community among the seniors out here, have activities, discussion groups, book groups, social events, just getting together and sometimes just having somebody call up a person and say, hey, how are you, what's going on? Or again, having transportation to get them out, not to go to a doctor, but to meet somebody or to go to an event. So is it going to reduce those transports? Harold Bebout estimated that ran 10%, and that was, I pushed him for that estimate, and he was leery of it. But, you know, we would like to reduce it to almost zero. I think that's probably not entirely practical, but working on it is certainly a worthwhile objective.
Dennis, thank you for mentioning that. I know that was one of the issues Harold wanted to make. And did you want to comment on that, Judy?
Well, yes, I had a couple of things. First of all, someone had mentioned Darcy spending the afternoon scheduling transportation. That was, since 2004, we've had a volunteer medical transportation called RapMed Rides that recently Darcy has been handling that, and Hal has been starting some, just going to the store too. Means that they've been expanding. So it's not just the cancer. It's for all kinds of medical issues. And I'm sure they always need more volunteers for that. I wouldn't know what our percentages are or what they are in the other counties in terms of the 10% or whatever. Certainly you can have someone that needs to go and get checked and maybe isn't that serious, but I can't.
There's a gap between services potentially that you have to step into at times.
Well, I was just saying I don't know in terms of the people that just call when there's nothing that much wrong. I don't know what that percentage is. But the Sperryville, I don't know what the overall percentages are, but Sperryville has responded to about 96% of its calls since 2009. And Harold has done, at the beginning of the year, he had done over 2,000. Wow. So we are getting out, and certainly Washington, and there's medics, it's happening, but obviously we need more.
But one of the things that Randy said is that it's uplifting but challenging. I think we're ready to open the floor. So we have about an hour. I think we might start with any questions for Randy, but any points that are related to these issues, and again, these are local issues we're going to focus on for the next hour. So, Annie?
Yeah, I just wanted to say that I hope that, Randy, when you consider healthcare in Rappahannock County, you do consider physical therapy, because I do serve about 100 clients a week, and I'm hoping to expand the more therapists that I can get. We also have direct access, which means that a physical therapist can look at any client and decide whether they need to go on to more important services or whether their services can be taken care of on a local or an immediate basis. I haven't advertised that very much because we are very busy, but I'm hoping to expand that opportunity for the public to know that we can do direct access evaluations for complaints, whatever they are. Also, I do feel like I do offer an opportunity for the public to have a place to go for a variety of different kinds of classes, and I'm hoping to expand that as well. I think the future of medicine, like I said before, needs to go more towards preventative medicine, towards corrective medicine, rather than the prescription kind of fixes that you tend to get when you go to the medical doctors. So I think that we have a lot of talented people in this county that have a lot of different healthcare skills. And it's kind of my goal to gather these people together in one place and give this community access to a different kind of medicine that may in the long run be more helpful. So I welcome anybody with ideas that want to come forth and get together with me. I'm also working on rehabilitative services. I think our community needs a place for are people to go. You talk about aging in place, but once somebody in this county has a stroke or a fractured hip or something like that, there is no place for them in this county. So all their family members have to travel to go see them on a regular basis. So you talk about a problem of travel, when your whole family has to travel and you can't come back to the county in which maybe you've resided in for your whole life, and there's no possibility of you coming back because there's no even short-term care facilities. So I am looking into wanting to have a short-term care facility for people. So anybody who would like to help me on that endeavor, I've been working on that idea for several years and have lots of things in place for that. So I think that's a very thing that we need to talk about and think about. And I think that our county needs some kind of a community center where people can go and access many different kinds of things that would help the isolation quite a lot.
Thank you. You want to comment, Randy?
Well, I did want to mention that there was a piece that I didn't write with the series about alternative medicine in the county.
Well, physical therapy is not alternative itself.
I know. But,
Okay.
you know, I think that in this, related to the second part of what you were saying, that there are people in the county with knowledge of alternative treatments and expertise in that maybe a lot of people aren't familiar with. And you know, I think that is an aspect of the county's personality that many people aren't aware of. And I know you have a lot of people who, your place has become a social place in a lot of ways. And it's where people go for therapy, but they also go to meet each other too. So, I mean, that's one of those things that's positive in the county. But, you know, one thing that, that I didn't mention before, and I'm kind of stating the obvious, but unlike in the past where people's families were here, you had your family to fall back on. You had your children who were here, and they would take you and they would make sure that your health was good. And now, you know, the children are moving away. So you have a lot of people who are kind of on their own and maybe they don't know their neighbors anymore. And there were several people I talked to who, you know, they told me their stories. They didn't want to be mentioned in the paper. But a lot of it was, look, I don't want anyone coming to my house. It's that simple. I'm a private person. I don't want people coming to my house. There was one person, I think, Hal, you probably told me this story, where someone was, in fact, it happened to you, where someone said, you had mentioned you want to go, do you want to need a ride to go shopping? And this older woman was quite interested in that, but she made it very clear that I'm not getting in the car with someone I don't know. And that's an absolute reality. You know, that's part of dealing with people who are, they're just concerned about, you know, what am I getting into here? So in a place, when you live in the city, you get in cabs all the time. You get an Uber all the time. Here, you know, it's a whole different ballgame. And someone had mentioned to me that one of the distinctions between most of the volunteer ride service now and a more comprehensive one is the way they're set up now. It's easier for you to get a ride to an appointment that maybe you know in advance. You know, a week, 2 weeks, a month, whatever it might be, you can set that up. But if you need to go somewhere now, an emergency, not, you know, where you can't call the rescue service, but you need a ride on short notice, lots of luck with that. You know, there's nothing that's really serving that purpose. And I think that's one thing that I know is being discussed on a broader level. There's a company called Liberty Mobility that's trying to do this sort of thing in rural areas around the country. And I'm oversimplifying it to call it a rural version of Uber, but in some ways that's the simplest way to put it. It's providing that kind of service, but you know, part of the explanation too is they want to coordinate with existing volunteer agencies, so it's not just them.
I think Hal had a comment, and then after that, we might want to go back to Liberty, and then I think we had more questions, more hands raised, but Hal, you want to?
Briefly, Lindsay has almost 1,000 copies of a thing called Guide to Services, Senior Services. And it's got tons of stuff, and I was referred to it myself this morning to find, oh, yeah, yes, good. So make sure that they get distributed. And the other thing is, I was really interested in what Rob had to say about connecting the county with your operation in Warrenton. What can we do?
You want me to address that now?
Yeah, go ahead, and then we'll go over to Matt.
In case you don't know, I'm the director of the free clinic, which next year will be our 25th anniversary as a clinic. And we've served both Fauquier and Rappahannock County since we started. I mean, that's always been the case. We do have a satellite operation that opens up here in the health department once a month. But more Rappahannock residents are actually seen in our Warrenton site than not. A couple of random thoughts. I mean, one, I have the greatest admiration for those volunteer transportation folks. You know, it's not easy to pick up a stranger and take them somewhere. And especially, it's not easy to take them to a doctor's appointment or a hospital. I think it must be really aggravating, actually. I mean, you ever gone to the doctor and they were running on time and then you left when you thought you would? I haven't. So, you know, if you've driven somebody 40 minutes to a specialist office, then you have to sit in the parking lot or something until they're done, and then the doctor's office is running 45 minutes late. That is a big gift to that person that you've made. I mean, to wait for them. And I've seen folks brought even to the free clinic in Warrenton who then had to wait, really, I thought, way too long to bring the person home. But I mean, what are you going to do? You abandon them there. You're only halfway done with the job. So I think those people need gold stars and to be trumpeted.
But something going forward, what would that be?
Well, a couple things. One, this last year, and it was written about in your work, which I thought was very well done, we've tried to bring, as a pilot project, some telehealth into the free clinic setting. You know, I come from the big city in Warrenton where we have all these resources, and I can tell you that it's not all that great. It's just a little easier. There is not a lot of psychiatry and not a lot of mental health supports in Fauquier County, and it's even tougher in Rappahannock. Now, that's not to say there's none. There are some. You know, we should think about what our strengths are. There are not a lot of physicians in Rappahannock County, but the ones that are here are outstanding, and I think I know most of them. You know, we're very fortunate in that way. But you know, as you said before, if you come out of med school and you were brave enough to study psychiatry, you owe a lot of money to somebody, and you probably can't make it by just setting up a shingle here. The other stat I've seen lately is that the average psychiatrist in the United States is well over 55 years old. So it's not something that a lot of new residents are jumping into. So it's getting worse, not better. So what we've done, we have a broadband connection into the clinic setting in Warrenton, and we have a pilot project that's been funded mostly by the PATH Foundation to essentially pay for remote care visits. So psychiatrists, counselors, therapists of every kind who are sitting on a computer screen and they're talking to a patient who we make an appointment and we have them come to the clinic. You know, the model could be done in homes, so you could take that at home and do it on your phone. That's not what we're doing. We're trying to integrate it into our care. It's not incredibly cheap. You talked about some of those third-party payment questions. You know, I work in uninsured care, so I don't know a great deal about that. But there are third parties who will pay. There are lots of clinicians who, psychiatrists in particular, who just don't want to bother with it. And so it's up to you if you can find a third party to pay for those visits. And you know, people tend to need a lot of visits. That said, it's worked really well. This month marks 1 year. We went from 4 remote care visits that first month to like 160 in the last 30 days. Those are Fauquier and Rappahannock residents receiving that service. So far, we have contained it as a pilot project to the clinic. I have no problem imagining a future where then we branch out, any place that has the broadband capability, we could bring the service closer to the people. The technical questions of where the broadband is available is sort of are not what I know how to solve, but I know that it's something that the community is working on very hard right now, and for quite a while. You have to have that though, or the other part isn't going to work, obviously. The computer, the hardware, the other stuff is easy. You know, you don't need anything fancy or something that's different than I have in my home to make it work. You just need a reliable connection that's very fast. You know, not so fast that you can't get it, but fast, or the video doesn't work. And you have to support the person. You know, you can't just stick somebody in a room in a box and then say, here's your psychiatrist, here's your therapist, here's your counselor, here's your substance abuse treatment professional. You know, you have to back them up. There are going to be prescriptions written, there's going to be advice given, homework to do, someone to check in with. And so that has to also happen. I don't think it's something that we can't do, but these are phase 2, like next step things that I think that we really need to get moving on.
Thank you.
So,
Matthew had one, and then we'll come back to you, Mike. You raised your hand up earlier?
Yeah, to an observation and a question. I guess a couple of observations. I guess the first is maybe more of an assertion, maybe. And I suspect that when I was listening to you, Randy, wow, the litany of our health challenges is, it's pretty overwhelming, and hence can be discouraging to, oh my God, why even try, or shall I just roll over? But I suspect that if we could make a 10% difference, 10% shift, i.e. maybe a reduction in the number of healthcare events, that would make a huge difference. And so maybe the challenge, or maybe the goal is not a sort of a big bang to try to fix everything at once, because that's too big. But if we could just go for a 10% solution, declare victory if we get to that point, and then move on to the next 10%. And a couple things that came to mind. One example is, geez, just from a rescue squad perspective, if we could cut down on the number of unnecessary transports to emergency rooms, that would take a lot of pressure off the volunteer force and make it easier on the patients. Another is would be, I think, what's it called, case management. There's a lot of hospitals are now finding that when they're paid by the case rather than by the procedure, so they're not being, it's like piecework, which is the wrong incentive. But the hospitals are now doing case management, health wellness, so try to keep people out of the hospitals, or they follow them up, and so make sure they're on meds. So if it's a chronic health condition, somebody's calling, or you can even use technology to remind people to take their meds. So you have a home health care aide. Maybe one of our RAPU graduates could make the rounds, work with our health services to just kind of check in on a regular basis. That would cost some money, but I would dare say the ROI on that would be pretty high, because you're going to cut down on rescue squad events, and you're going to it's going to be less wear and tear on families that have to go out of the county. And that all leads me to the general question of what did you learn? As an economist, I want to think about where are the leverage points, and I guess with respect to what, but sort of on the demand on our healthcare system, whether it's the number of events or severity or cost, or and then there's a counterpoint, of course, is the patient and their family. But where are the leverage points? Is it wellness? Is it home health care aids? Is it family? The driver certainly helps. But where do we get the biggest bang that would make the biggest, how do we get to that 10% reduction? The quickest for the least amount of money and effort, and maybe time. I guess that would be my first question to to you guys.
Yeah, I wish I had that one answer. No, I think just quickly on that, I think a lot of it, and people use this as a fallback position, a lot of it is education. A lot of it is letting people know what their options are. And I think that, you know, that the calls to the rescue squads, some of that is just like, well, I have a problem, 911, you know, that's the only thing I know. And I think it's important for people to know what their other options are. And some of it is just getting that information out there. And then, you know, one thing I did hear from when I talked to Harold, he had said that they've noticed, and this is not measured scientifically, but he's noticed that they've had fewer calls based on chronic health conditions. So someone with COPD or severe diabetes or the sort of things that they got more often in the past. And his feeling is that, well, people are getting better medications, for one thing. And they're taking a little bit better care of themselves. So they're not getting those kinds of health issues as much. But to your point about case management, I know that's one thing that when you looked at the place that has been open on 211, the idea there is to kind of use that, and I hate to use this term because it's oversimplifying, but it's kind of as a satellite unit that would allow you to start doing more of that case management. And when I talk to the hospitals, they see that as part of their future business. Can we get into the case management business on a local level? And it's something that, you know, with anything with healthcare now, there's so many variables and so many things that may happen or may not happen, so they're wary about making a move, but they know that they need to find other sources of revenue. Otherwise, they're going to really, really struggle. And so I think that's a point that they're looking at. I wish I could say, yeah, if everyone did this one thing, that would make a difference. I do think that there are so many volunteer things going on, and I think the better they can be coordinated, I think that's an important thing too. I mean, everyone is trying to do their thing, but I did see, from my perspective, some overlap. And I actually asked the people with FAMS, I said, so if you get a call related to this, who do you refer it to? You know, I mean, you refer it to this or this or this, then why? And there really wasn't a clear explanation of that. Now that may improve because FAMS is, you know, ramping up. FAMS, in case you don't know, is it's based in Culpeper, and basically they've taken on the role of trying to be the coordinating organization for all these volunteer transportation services. And so they work with Darcy, they work with Rapid Home, they work with Voltran in Fauquier County, where they will refer callers to them. But part of the problem was they did I think it's fair to say, a pretty bad job of promoting themselves in the past. It was just kind of, oh, I didn't know about that. And so now they actually have an office in Culpeper. And so they're, yes, well, Eve, you probably know.
No, I'm just going to say, either way,
yeah,
no matter what you do, if you want to create transportation systems dependent on volunteers, your holes are going to be huge. People are not going to use them. They'll know that they're weeks ahead. Or a week to get it arranged. And unless we create a paid system as well that ties to it, we will have, and we will continue to have, huge holes. Now, there are ways to do this, and I think that there's a lot of hope, potentially, in Liberty Mobility's approach. So that you could take that FAM system and build some strength into it, so that you can build a paid system on top of it that makes, for example, Rob, what you might have is somebody who could actually, you have a volunteer to lead them, but you need to use paid on the way back. And there we could actually secure some subsidy for some of the paid people. And further, and this is the beauty of it, because these are really part-time jobs, but they're paid, they're paid less than Uber. They're still paid positions, and they give folks some employment. That's another problem we have in this county, is employment. So I think we really need to look at the discussion now underway with the Path Foundation and the Planning Commission. They are looking carefully at that, a proposal from Liberty Mobility. And they don't have all the data. They're doing their due diligence. But I think it's a very exciting opportunity for Rappahannock County in particular. And it would be great to have some other people join me in working with them and hopefully finding a way of bringing them in.
Eve, if we can just clarify, in case people don't know what the Liberty is, it's a new organization, began, I think, in Nebraska, is now moving into a number of steps and trying to address the puzzle of local transportation, and it's not Uber-like in that you can make calls in advance, and they also have options for working with nonprofits. Is that correct?
Yes, they can actually, some of the money can go to a nonprofit that's working and teaming with them.
So it's an attractive model, but it's still kind of a startup, and so
They're getting a lot of money at the moment from United Healthcare, which means that the health providers are seeing the great advantage of having this. So it's going to take some time to put these pieces together, but hopefully, and they're trying to grow very fast, which is a bit of a problem when you're working with folks. But I think there's some real opportunities here to marry our transportation volunteer system with a paid Uber-like, not system which is not totally dependent on cell phones, which theirs is not. So I see a lot of hope there. I think there's one other area, in the area of mental health, having done a lot in the area of school-based mental health. Our children get mental health where they are, and they are in schools. So building high-quality school mental health, which I'm not sure we're doing yet, and doing it regionally would make a lot of difference. It's where the kids are, and the Medicaid systems can pay for a good part of the kids because of special ed. The non-special ed kids also need coverage. But that's the way to assure people actually go to mental health, in addition to having the telephone systems here, which would be great for the older people. So.
Mike had his hand up for a while, and then I'll go back to Judy, okay? So, Mike?
Okay, mine is a little bit of a diversion, but I think related. One of my hats is I'm a member of the Broadband Committee in the county. And to the extent that telemedicine is going to become important, and the extent to which we lack internet services, our lack of telemedicine is going to become more and more serious. And I won't elaborate any more on that, except to tell you, if you have not taken the survey, please do. Tell your friends about the survey. Tell them to take it, because the chances of our doing something about internet service depend in part on the extent to which we get responses
All right,
to
so
that survey.
how do you take the survey if you haven't done it yet, Mike?
Todd, you know better about that than I do.
rapbroadband.org. Or if you don't have internet access, to fill out the internet access survey, you can get paper ballots. Everybody can be some here, but the county offices have them.
What was that site again?
rapbroadband.org.
Or you call me and I'll get you one.
I heard a troubling statistic yesterday about that survey. The response rate needs to be a minimum of 750 in order for that survey to be valid. And the number I heard yesterday, Todd, was
400.
400. So that survey's been out for a while. They're going to do a postcard, but I'd love to see the county support that effort in greater ways. And maybe there are other organizations here represented who might be able to help spread that word in significant ways, because that's critically important to our county's future.
Right, so that's something that we can all do in terms of trying to get. Judy, you have your hand
Well, the
up.
first thing on that, is that supposed to be only one survey per household?
Yes.
Yes.
That's what I thought, okay, that's.
You could always drop off surveys at my office. We could put them at the front desk. I'm sure that would get a lot of people that
It
may
takes
not.
no more than 5 minutes to complete the survey. It is really a very, very minor
Yeah. All right, so that's something to do. Now, back to Stephen, you had your hand up.
You know, everyone knows that these issues are large, complex, national systems, regional systems, problems of reimbursement, insurance, transportation, providers. But I want to circle back for a second to my friend Annie Williams. And I think you can look at Annie's operation as a lighthouse in a dark and stormy sea. Annie is a business woman. She's not the federal government. She's not the Ford Foundation. She is our local small business entrepreneur. And in her area of service, she's providing outstanding service and making a bit of a living at it. And she's not relying upon charitable contributions. She's not relying, except for Medicare and Medicaid, insurance companies, she's not relying on tax dollars. And it's an example, I think it's a very important example, of an individual who's got business skills and provides the leadership to operate a small business that serves one category of need in this county very successfully. So it means that we're not always the prisoner of huge national problems and systems and taxation and all the rest of it. One person can make a difference. And full disclosure, I'm a happy patient.
Okay.
All right, so now back to Judy.
Okay. All right. First of all, the case management thing, my career was primarily in public health, like including in Arlington. And one of the things we had there, which was very helpful, which is sort of this type of thing, is you would be sending nurses out either on the chronic or on the, advanced care, so that they make sure they did get their medication and so forth. And I know they do all sorts of things with paramedics and so forth now, but that has always seemed to me that would be a big helpful. And this isn't on the healthcare side so much, but in terms of where do you call and coordinating and so forth. There's just started a pilot project with the Benevolent Fund and Trinity Episcopal and other churches and so forth, with a community worker. Lindsay? Oh, yeah. She just started, and the idea is to try to help some people know where to go and to smooth things through. And one of the issues, which also Harold had brought up in regard to that, was social services. So being able to work with social services as needed to help some of these people get what they need. And Sharon Pine was so good with that, but is now retired. So this new community worker hopefully will help figure some of that out.
Judy, I think one of the problems you run into as you try to put nurses out there, therapists out there, and even doctors, the problem that's going on right now is that in order to get reimbursed by any insurance company, the amount of paperwork that is involved for your nurses, for your home health care aides, becomes unobtainable almost. And so, because I've worked in the home health care setting for years and years, and that's just one of the problems. I mean, it would be lovely if we had an organization that was funded by our community that would provide something like that. But as soon as you go into the Medicare, Medicaid arena, you're talking about a whole nother ball of wax, and it's very hard to survive in that community. 50% of my patients probably at least are Medicare, and no, I don't make a lot of money. I just survive, and I allow people to work in this county and have services. But no, if you go that kind of route and you're just under insurance out of the iota, and that's been one of my concerns about some of the things that are leaping up in the community as everybody wants to try to do something to help the community, is that people are going into groups for exercise and things like that with what is the liability coverage for these people, because I've seen terrible accidents even in my own facility where we make every effort to try and protect people. And without liability, I wouldn't survive a day. So I think that as these PATH Foundation things that get get fit and get healthy and all that, that we have to really look at. I mean, I volunteered for the elementary school, and 30 minutes after I got there for volunteering, I had an accident which led to a $60,000 surgery and potentially the loss of my career. So I think that you have to, everybody wants to do good and do well, but I think that we have to look very carefully at some of these programs and what the insurance is that's covering these people's liability as well.
Thank you. Now, Bud, you had a comment, I think, or question.
Great conversation. I want to bring us back to the series that Randy reported in the newspaper presented. Part 2 focused a great deal on fire rescue, aging volunteers, looked at statistics and basically said they're doing their job and doing it well, but is that the future for the county? And the sort of the 900-pound gorilla question that this series raised is, will Rappahannock have to bite the bullet and professionalize? What are the consequences by bringing in trained, paid EMS people? That's still a big issue, and it's still kind of hanging out there. It's one of those things that's kind of been kicked down. Part 3, just to get this on the table, really, as I recall, said there is a loose confederation of organizations who've really taken a bite at this apple. Many of them proactively. The food pantry with their health programs, Commit to Be Fit at the schools, the work that Rapid Home is doing. The series suggested, and maybe the conversation suggested here today, perhaps a little greater coordination of those diffuse volunteer efforts might get us to that 10% goal we heard from Mr. Black over here. So I hope we can, I want to throw those 2 balls out into the court just to make sure that they are acknowledged and addressed.
Okay, so Randy, do you want to comment, and then we'll see if other people want to comment?
Yeah, just one thing first related to the paid versus volunteers for the rescue squad. I mean, that's something, as you know, part of the problem is the county has kind of been a victim of its own success with the quality of the volunteer service, that they've been able to say, well, we don't want to pay for that because that could be a significant cost to do that. And then there's something that I really hadn't thought about until I was talking to Harold and to others who are active in this as volunteers. And they said that one thing you really have to do once you make that shift is you're kind of changing the whole nature of the rescue service. And one thing that often happens is when the paid people come in, they say, okay, we're paid, you're the volunteer, you just go and do your little thing over here, we're the professionals here. And there's a fear that there could be a real friction, or you could have a lot of volunteers say, you know what, they're treating me like, you know, someone who's in here to sweep the floor, I'm not coming around anymore. I mean, volunteers, you're dependent on them being very generous with their time. And you're kind of changing that whole culture. And so, you know, I don't know what the magical formula is, but I think the intent is, the reality is, and I think everyone I talk to, certainly on the county side, is that this is something that's going to have to be addressed sooner rather than later. But, you know, there is that whole issue of what does that mean to this community and how do you coordinate that? And you know, as someone said to me, the paid people, if it goes to this, they most likely do the daylight hours. So what does that mean? That means the people who have been working diligently for a long time, well, you got the 2 o'clock in the morning calls, okay? We're the professionals here, we're doing 9 to 5. And you know, they're real issues that you're gonna have to address. Am I right? Okay, so you know, I think that it's a very important issue, and again, I don't want to get into political things, but I really don't think the county can continue to kick that one down the road. I mean, please, you know much more about it than I do. So, and it's not in any way to denigrate what's being done. It's just, you know, how do you make this work?
I think the concern was that painting it as sort of a imminent crisis. I mean, it's certainly a concern. The number of calls is, varies, but it's a lot. And we do get a lot at 3 o'clock in the morning for people that don't have acute healthcare needs. You know, I've gotten up at 3 or 4 in the morning to toilet people, and that wears on you after a while. So I wanted to raise 3 points. One is that we often are called into people's houses for something that's acute or subacute, but we don't really have a very active way to connect them up to social services. And there are people that are in cycles, and you can sort of see people that are in a bit of a cycle because of healthcare, or they're kind of that point where staying at home is probably not going to be possible in the near future, but then they call us a lot in those weeks and months. And I think we can do a better job. We're in houses where the living conditions are unacceptable, and we see people living in extreme dire poverty. We see lonely people, we see people with dementia, and we don't have a very active, when something is critical, we'll call social services, but half the calls I go on, sometimes I go and I say, Harold, we should call somebody, because that just shouldn't go on. That person shouldn't be living in that house. The second, which you haven't talked about, is drugs. I personally have been on 5 or 6 opiate overdose calls in the county, and I don't hear people talking about it as if we have a bubble over us, but we don't. So we have opiate problems. We have a lot of alcohol problems, including with seniors, and that probably relates to mental health services, but we have a significant problem that doesn't seem to get talked about too much. And the third thing I wanted to say is that I feel like we need a plan. It's great to have a discussion. It's good to have newspaper articles, but I feel like we have no plan. And we have supervisors that are unfortunately mired in kind of conflict and lawsuit and FOIAs. And it does feel like it would be nice to have actually some plan to get to the 10%. And maybe that, I'm on Jane's board and I've worked with other foundations, you attract funding when you have a plan. I don't think we have a plan, and I think it's therefore going to be harder for us to stitch these things together. So I don't know whose responsibility it is, but it feels like this county could benefit from having a plan to take on some of the challenges raised in your great series.
All right, Jack's had his hand up before. Did you want to comment?
My understanding of volunteer versus paid is it doesn't work. Nobody's figured out how to make it work. It becomes a slippery slope. Pretty soon you're paid. And my daughter's a paid paramedic, and I know what her attitude toward volunteers is, and I want to shoot her for it. But you know, we have our discussions. I've been a member of this department for 44 years. 44 years ago, it was a bunch of young folks doing stuff. And now I see the Heralds. The Herald hadn't been here doing it for 84 years or whatever. The last time that I saw a growth statistic for this county, which was a little while ago in the Rappahannock News, it was us boomers who were the growing, retiring boomers were the growing folks. And a lot of those have ended up in fire and rescue. Somehow we need to let the rest of them who came in know there's something worthwhile to do here. We're into so many people who think, oh, everybody's paid, aren't they? You know, I've been told that on calls, and that was 30 years ago. To try to, if there's any hope for the volunteerism here, it's to recruit more of us retired boomers in doing it.
Keep trying.
Okay, but I just offered that. If there's an answer, otherwise it's going the other way.
Or the young people, what about getting the...
We don't have as many of them because we threw them out because there's no place for them.
But we have high school students that are...
And we have some good folks in this
read,
department. We have some wonderful
you know.
folks in this department. It's been good. That's not enough to answer it.
Judy had
a few minutes ago, there was a distinction made between, we use professional versus non-professional. It's a distinction between paid versus volunteer. I think that's a misnomer, misuse. Our volunteers are very professional. The squads are run very professionally. They get a lot of training, take exams, they're certified and so forth. I would call our volunteers professionals, and I would, if you're going to have minutes, make the distinction between paid or volunteers.
Yeah, and I think that when I said that, it's more from the perspective of what people have told me. When the paid come in, they view themselves as professionals versus from their perspective, the volunteers are amateurs, which isn't the case. But right. You know, it's more a matter of perception. I'm getting paid, you're not. And I know all the training that the volunteers have to go through, it's extensive. I mean, it's really one of the reasons, as you know, where there aren't as many volunteers, because it's so demanding.
Yeah.
I just had a question related to rescue squads and the finding drugs and alcohol use. And wonder, because we don't have a hospital in this county, we don't know always what the level of those drug and alcohol crises are. And so I'm wondering if the rescue folks here can give some context or idea of how many people, how many calls you get from Rappahannock County that are taken to hospitals in Front Royal or Culpeper or Warrenton for drug overdoses or alcohol problems.
Varies. There's a cycle where products move through the area that are stronger or laced. And so we'll see them, they'll hit Warren County, they hit Rappahannock County, they hit Fauquier County, they hit Culpeper, they hit Madison. And we talk to folks when we're at the hospital and they see many more cases than we do just because of population size. But they tend to run in cycles, so we'll have a couple in a month and then we won't see one for a while. But there's stuff underneath the surface. So there's the acute, people not breathing anymore because of an opiate overdose, but there's a lot of other stuff that's not that level but is causing other health problems. And a lot of alcoholism too. And our job is not to figure that out, and sometimes we don't even know it's there. So we guess sometimes why we're taking somebody to the hospital. We don't actually get often information on what actually the medical condition was that the person was dealing with. So some of it's just guesswork.
I would just add to that, one of the difficulties I found, I did a sidebar on the opioid issues, was getting a real number for that. And I went to the various rescue squad stations, and to your point, a lot of times they really don't know all the time if it's an opioid overdose. But there's no, and unless I missed it completely, there's no one organization that's responsible for compiling that and making that available. And so I was like pulling some from here and some from here, and frankly, it kind of surprised me that there wasn't an easy way to get that information. But yeah, I think it's like, a lot of this stuff, so many things are done on a volunteer basis or on a piecemeal basis. And maybe it goes back to the point about the role of the supervisors of the county government. I think there needs to be more of a leadership role just to say, well, okay, let's pull some of these pieces together.
So I think that's sort of sitting on the table. You put it on the table, the possibility of leadership or coordination or so forth. So I'll invite comments on that, but first there was a hand here.
Hi, thank you. I'm Sue Rayford, and many of you know my father, Chelton Rayford. If you don't, anyway, I'd like to address the opiate crisis. In part 3, it said, at the end of the article, it said, so far Rappahannock has been spared this crisis. It has not. It's rampant, it's secret, it's underground. These are seniors that a lot of the volunteers that offer rides to doctors, these people are going on a monthly basis at least, and they're going to see pain doctors who then give them the opiates. And often these people, as they become financially distressed, extremely financially distressed, they're going to start taking half of their opiates. They're going to sell them to the 28-year-old kid next door, and there's our epidemic. So here you've got, and also the more isolated a person is addressing opiates and alcohol, the more they're going to abuse it. So they're just not only destroying their lives, but they're destroying the lives of their loved ones, their friends, their whole environment. And these people are not reachable because they are ashamed. They are so terrified. They're so terrified of their addiction to both. They're so isolated. They're so out of touch with reality. And coming to, again, the transportation, where volunteers are transporting these poor people to basically doctors who are going to say, here. So that's a whole different dilemma.
Another way of looking at it. Well, we've heard a number of things that come up again and again. Things that may give us ways to get at 10%. I like the way you set that up, Matthew. Transportation is huge. Case management, which could address issues, something like that. Isolation, which is part of the problem that you just talked about. Coordination among the full array of health services, and that relates to education and getting the word out and getting those 1,000 brochures out and those kind of things.
I just went to pick them up actually,
good.
so please take some as you leave. That's a really good idea.
That's fast action. So this has been a great discussion. We have just a few minutes, and I wonder with those things in mind, Stephen, would you like to be a volunteer to make some final comments before our time runs out?
Oh dear.
Well, I will feel a couple people out.
I wanted to cycle back for a second, following up on what you're saying about trying to identify the major challenges, the major points. And I thought, Todd, that I thought you made a very important point, which is the benefits.
You told me to, Steve.
The benefits of writing a plan. Could you just, I don't want to put you on the spot, but could you take a minute and just share with us your thoughts about who would do that, what would be the content of the plan, who's the body that writes it, what do you need in terms of experts, and I recognize that you're probably not prepared to answer all of this in detail, but could you just share us a little more?
There's lots of snide comments coming to mind about who shouldn't do it. You know, there are a lot of foundations that are around us and have been very supportive, and it seems to me that would be a great proposal to have someone come in and help. But the problem is that it has to be owned by this county. You know, if we don't develop this plan ourselves with some help, you know, it's going to be, it'll launch into that outsider kind of thing. The come here has brought us this. So I think that whatever the plan is, and I'm sure that there are people who are skilled at doing that, it's got to be done with this kind of a process so that Rappahannock and all of its diversity is part of that solution. I do know that, you know, as a former foundation person, having a good plan that's simple but has, you know, kind of measurable objectives and steps attracts funding. And I think we would do very well by getting something together, even if it's a plan to develop a plan, and selling that to some foundations and saying, look, we have to figure this out. We're certainly not alone. There's probably people who figured out parts of this. Let's come together and do that. That to me would be a good next step.
Judy, can I just comment on things? Absolutely. The one thing is involving not only local people, but involving people like Ann Speaker and Harold and the ones that know what is needed. You know, we did have the consultant firm come in and make recommendations, and it was, never mind, because they did not know the situation. But in any case, one other quick thing is on the professional versus the volunteer, and I absolutely agree with everything you said, was that you're never going to be able to get comparable with paid, because so often you'll have several calls at the same time. You'll have, the other day we had every ambulance in the county on an accident except for Chester Gap. And then, so you need the volunteers. You don't want to drive the volunteers off. You need more medic capability, including at night. But you've got to, it's very difficult to work out.
But I would just say, and it's, you know, well, I really don't want to say form another committee, but I know there is a broadband committee now for the county. And in my mind, you know, there should be a healthcare group that's looking at the plan that's being discussed here, because there are a lot of different pieces of this, and just in a relative little time I spent on this, I could see that this person was talking to this person, you know, and if someone was looking at all these issues and trying to figure out where there was overlap, then you can at least identify what could be done and where maybe you could go to a foundation to focus on a specific thing. And I think it's just been, it's been relatively easy, as it has been with broadband and cell service, to say, yeah, it'll work out. You know, Google will come in and save the world, or someone's going to come in with some great solution. And I personally don't see it. I think it has to be something where, to your point, Todd, you know, that the county has to say, this is important to us.
Yeah.
We're not going to rely on all these volunteers just, you know, working like hamsters to make all this stuff work. I mean, again, people are doing an incredible job, but it's because they're committed to it. And as everyone here knows, with a volunteer service, you're walking on a tightrope, you know, and Sharon, you mentioned Sharon Pine before. I mean, she gave me probably the best quote of the series. She said a lot of our volunteer drivers are going to soon become riders, you know, and I thought, well, there you go. That's it in a nutshell. And I think it's important for, at a county level, to address that and get the people who are involved here. You have something like the Commit Big Fit program at the schools, which I think is great. I mean, that's a community-wide effort. But kind of, you know, people think always at the older level here, but, you know, you're talking about it really at the family level. And that's an important part of it.
Could I comment on that really quickly? I think the schools have a very important part in this conversation when you're talking about proactively addressing the community crisis that we're seeing. Our approach was a three-pronged approach to inspire a community wellness program, but it was multifaceted because we had the school nutrition issue that was a major issue in the area, plus in the nation. Kinesthetic movement in the classroom, which has been lost due to high-stakes testing, and then also the, you know, just bringing in the community. We are the hub of a community. Schools generally are in a rural setting, so we have a great obligation to tackle some of these problems. And so what came out of our $100,000 pilot program was $311,000 bona fide program that looks to be continued indefinitely at this point. But other partnerships came out of that. With Wrap at Home, we partnered with them to offer Lyft for seniors, concurrently offering their program that they began. The backpack program has been very successful in our schools, helping feed those underprivileged students very discreetly, and it's a wonderful program. And the farmers have come on board to help get local foods to our cafeterias, and we're offering some amazing meals to these students, that meals that some of them would never see in their homes. So what's growing out of this is a very proactive approach, but it's also a common thread. So talking about your risk capital, about showing the community this is important, I think Commit to Be Fit was a way to show this was important because of all of the support that just rallied around this singular topic of community health and wellness. So I thought that was great.
So we have run out of time. We all agreed to stay here, but we've had three people who had their hands up that I nodded to. So Barbara, Ellen, and Sheila, and then I think we'll probably at the end.
Just very quickly, forgive me if I have not recognized you, but I don't see a single supervisor here at this important subject. And why is that?
They're responding to lawsuits.
Right? Am I? Ellen?
I wonder briefly if anyone can tell us how effective Healthy Culpeper, and I think there's a Healthy Fauquier group have been in terms of perhaps taking the lead in something like this, you know, a Healthy Rappahannock kind of group. Can anyone speak to the effectiveness in those areas, whether we could do that here?
Those are great. Those are just speaking about monthly meetings that occur both in Culpeper and Fauquier County, and people come from multiple counties to go to both. And they're sort of great networking news groups that get together for a couple hours and share everything they can, services, upcoming events. The thing that we see over and over again is the different satellites of things going on that we try to partner and connect and make collaborations with. And I know you know, our foundation is much smaller than the PATH Foundation, but it is something that, and in Culpeper Wellness, I work with both of those groups a lot to understand how can we do things more efficiently, how can we work together. I mean, we don't want any executive director to lose a job, but at the same time, if we're doing lots of similar things, we can learn and partner and be stronger by doing it. And both of those groups are good groups. There's the networking opportunities is probably the best outcome.
Would you say there would be a model for something here, a Rappahannock something?
Well, yeah, we've been talking about it, and you know, we did it a few years ago, we did the Rap Link, which was the, you know, nonprofit network for Rappahannock County, and you know, we're little. It was hard to get. It's like when we run a bus somewhere. If we have 4 kids on it, we say, whoop, that wasn't worth it, but that was 4 kids. So because of our numbers, sometimes it's hard to see the value in how things work. And I do know that, for instance, we were talking about travel before. Voltran and I did some research, because when we get grant applications, we look at all the counties and we call the other foundations, who have you supported, what have you done, and we did just give a nice grant to Voltran, who said they did support Rappahannock County, so Lindsay, that should go on your, okay, good.
They do.
Great,
Yeah.
great.
Housing.
Good.
Thank you, Jane. Now, Sheila, you had your
I just wanted to make a point that Todd has sort of brought up, to be able to possibly form a cohesive, like, healthcare committee plan. But the other important thing is we're talking about aging, and the way to be resolving a lot of these problems, in my opinion, is the problem with the schools is a great thing. You have to bring the next generation on. That's the only way to be able to go forward in a positive, healthy way. It's involving the next generation and the following generation. So there has to be a way of involving the younger kids and helping that spread forward. Like, as an example with my farm, I have my son involved, I have my granddaughter involved. So that's the way I'm going to be able to, hopefully, they're still speaking to me, go forward. It's getting them together, they'll talk to their friends. That's the way with the young kids. They're going to talk, and wherever they go, they'll talk about it as well, and you'll be able to start getting some kind of an energy to go forward, which is what we do.
To go back to Todd, as we close, you made the suggestion of a plan and some coordination. Where would you think that appropriately starts?
God, if I say the Board of Supervisors, I can hate myself. The Board of Supervisors.
Everyone will hate you.
You know, it's a great question. If we had, maybe the county administrator could help pull something together. The problem is if we do something with the Board of Supervisors, then it becomes official. And then you have every crank in the county on you about, I mean, sorry, we were going to send out postcards for the broadband committee, and we got an email from our favorite lawyer in the county saying that if 3 or more of us were together, it was a meeting and therefore had to be FOIA'd and announced and blah, blah, blah. I mean, it's just ludicrous, the environment we're under right now. So I'd say maybe informed and connected somehow to the Board of Supervisors, but not official. So, you know, there's a lot of smart people in this county, a lot of people, a lot of experience. I'm sure we can get a good group together to come up with a better plan than, you know, me on the spot.
So how do people reach you? Would you
Call 911.
Either right to the committee.
On that note, I would like to thank everybody for coming. I think it's been a tremendous discussion. It sounds like maybe the start of more discussion. Bud, would you like, as our chair for Foothills,
Can I say one, which we haven't talked about, somebody mentioned prevention here. There's no gym in the county, except for, Ann's got some equipment. But the high school used to be available. I got a few pounds I need to kind of work off.
Join Fit to be fit. We have
Right? Well, and the high school gym used to be open.
Dial 911.
We had a lot of trouble getting the first step on rep trails going. Thank God we got that step going. But we need more community capacity here to be healthy. And I think that would also take a step in reducing some of the ongoing later issues we're seeing.
Stonewall Avenue is building a gym.
I know.
Some good news that I heard yesterday, that the former Stonewall Abbey is being turned into a new business, a gym serving Sperryville.
Yeah.
So there you go.
Start.
I feel tremendous energy in this gathering today. In the last hour and a half, we've heard some really great ideas, leadership, passion. I hope that whether it's the supervisors who take the lead or less official but still caring group coalesces around these issues. I hope that Foothills Forum could play a role if it seems to be helpful. I do think that follow-up coverage out of this and future gatherings could help build momentum.
And our function, of course, is to promote coverage and promote the education part and shining the light and providing in-depth journalism with our partner RAT News. And
exactly.
It feels like we've been coming up with story ideas as we've been sitting here. Well, Randy?
No, just one thing I wanted to say
Final
related
word.
to that, okay. There's
Final
the
word.
story will be about the mobility because that'll be focusing on transportation. But I think it's important for whoever is writing about that to make that a health issue too, which maybe seems obvious as part of this conversation, but it's, believe me, I know from being a reporter, you tend to focus on, okay, we're talking about transportation here. And it kind of gets, you get too narrow a focus on it. I think it's important to say, this is why it's relevant on this far larger scale. So that's just going forward with that.
Okay, well, there's no reason people can't linger here for a bit and continue to chat, but I'd like to thank you all for coming. It's been a great
Something. It's my exercise over there. Andy!